What is up, world? Your boy's alive. Doing my thing. Welcome. Hey, today is Friday. The 15th of September. So welcome everybody. We're going to be doing some NCLEX questions. I'm going to give it some time for everybody to jump up on here. So, we doing our thing. So shout out to everybody that's jumping on. So I'll give you guys a couple quick updates because I'm pretty sure everybody's like, oh my God, where were the questions on Wednesday? Look, I got something for y'all. Okay. So I got my co-hosts that are jumping up in here. So, we'll just wait for everybody to jump up in here. Give it some time. So, hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, this is what we do. I want to know where the new folks are. I want to know where the old folks are, so I'm listening. But still, I got you. I know you're doing your thing. I ain't even worried about it. I got you. I ain't even worried about it. We good. So shout out to Nurse Nelly, y'all. She's out here doing her thing. So I'm here on time. Avery, shout out to you being here on time. That's what I'm talking about. So, but it's all good because you already know if you don't make it, you can head over to YouTube and you can check that out too. Because it's always going to be there for you. Or some people have actually reached out to me and asked me a couple questions, about, I guess, certain questions or, like these, the strikes and stuff that are coming up and, just all kinds of stuff. So shout out to you. So for those that don't know, I had surgery. I mean, most of y'all didn't know, but I had surgery on Tuesday. I had a meniscus repair from an injury that I had sustained while I was at working as a nurse. So I finally had surgery on that on freaking Tuesday, and your boy will be out of work because can't really do nothing with a knee that's all messed up. It's like swollen 2 times the size of my head or some shit like that. So, but we out here doing our thing. Still braced up, but we're still coming out here to get y'all these questions. So I appreciate everybody being real patient with me, especially in regards to laying up and dealing with all this pain and stuff like that. Hey, pain hits you kind of different, versus when you're 15 to when you're 35. You know what I'm saying? 20 years it'll do it to you. You know what I'm saying? I'm at work, but when I leave, I'll come home and hop back on. Okay, shout out to you, Avery. Shout out to all 13 of y'all that are up in here. Hey, today we're going to be doing NCLEX style questions. Make sure you guys share. Make sure you guys smash that like button. We're going to be going over NCLEX questions. I'm just waiting for everybody to kind of come up here, give them another 5 minutes. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. My name is Kevin. I go by the Boot Nurse. You guys can't really see it on my shirt, but I go by the Boot Nurse on all social media platforms. And yeah. Make sure you guys go over there, check out YouTube. If you know anybody that needs this, make sure you share it to them, or also let them know that they can find it on YouTube as well, because I put all the recorded TikToks on YouTube for those individuals that may need it. So, my guts passing. Hey, shout out to you. Hey, everybody show is it MGut? Show MGut some love right there for passing that NCLEX. At 85 questions, shout out to you. Welcome to nursing. Are you an LVN or RN? Let us know. Everybody give that individual their flowers because we already know that exam is not easy. All right. So shout out to you. Lydia said I'm from Arizona. Shout out to Arizona. I know it's hot there. RN, that's what I'm talking about. 2-year. You got an ADN, BSN. What are the goals? What are you planning on doing? That's what I'm talking about. Shout out to Karina being here. Victoria, what's up? How are you? Got 83 people up here, man. Y'all came up in here super fast. That's what I'm talking about. Hey, you already know what the deal is. We're going to be going over NCLEX questions. So like I said, make sure you guys share, smash that like button. The more likes you guys give, the more questions you guys get. So, good, Howard. I'm good. For those that don't know, I had surgery on Tuesday. I had a meniscus repair. So now your boy is just kind of chilling at home, and he's going to be chilling at home for a while. So I'm going to be doing my thing. Unfortunately, I failed twice and can't bring myself to take it again anytime soon. Any advice? Well, is it Jilly? Jilly, you must be new here. So welcome. You said you failed twice and you can't find yourself to do it again. Well, I'm going to tell you right now that everything is your fault. So what are you going to do to fix it? I failed my exam 3 times. So you coming to me telling me that you failed twice. The first thing I'm going to say to you is that it's okay for you to fail. It's okay for you to be unsuccessful at that exam. Right. But the question is, what are you going to do now? Are you going to sit there and just be like, oh my God, the exam beat me. Oh my God, what am I going to do? No, you gotta pick it back up. You got to figure out what you did wrong. Because it's all you. It's only you that's taking this exam, right? You got to figure out what you did wrong, and you need to improve upon it. So you got to think, did you have an issue with content? Did you have an issue with NCLEX style questions? Environmental factors, like what are you not understanding? what are some things that, that you wish you knew that you didn't know? So you gotta, it's the overall person. It's not always just about questions and answers. Okay. I hate how people say that, but it's not just about questions and answers. So, Victoria says, speed recovery. Thank you. Molly said, hey, 40 years of nursing, you retire in 2 years and 2 years and 3 months. Shout out to you, Molly, a nurse for 40 years. Lord have mercy. Lexi said, pass my first 2 tests. Hey, shout out to you, Lexi. Oh, Lexi is back. Okay, shout out to you, Lexi. Kevin said, do you recommend work experience before NP? Well, in order for you to become a nurse practitioner or for you to even go to school, you have to have at least a year of experience. At least I know that's what most of them that are happening right now. So, Striplin, what's up, girl? I see you follow. Shout out to you for the follow. I know that name anywhere. So, shout out to you, ma'am, for the follow. But like Queen, who is it? The Queen of Questions is Lexi, because I know that she's up in here. But Striplin, I ain't seen that name in a long time. But hey, shout out to you, girl. Shout out to you for being up in here. So, but yeah, shout out to all 58 of y'all that are up in here. If y'all don't know who I am, which I'm pretty sure you don't. If you're new here, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys check that out. We're going over NCLEX questions today. Do that in the next couple of minutes. I want to know who you are, where you're from, and where you're at in your nursing journey. Can you talk about ICU or OR nursing? I could talk about both because I've worked in both, Kevin. And ironically, my name is Kevin too. So there's that. Kevin, you may need experience in the ICU setting. Oh, it depends on what type of nurse practitioner you're trying to be before you become, like if you want to be an acute care nurse practitioner, you have to have some experience in acute care like ER or ICU. Okay. So I think we're pretty good. I think we got enough people up in here, so we'll turn this thing around, and whatever question you guys got, you guys ask. My moderators, my people that are going to be handling this chat. You got Monica, she's down there. She's going to be handling the chat, and then also you got Nurse Nelly, who's down there handling the chat. Yeah, they're going to be doing their thing. So Gut says the way I see it is how can be an advanced without practicing as a nurse. That's true. That's true. So you have to have experience as an RN as a nurse before you can apply for an NP program. Okay. All right. So with that being said, I'm about to turn this camera around and we're going to do some questions. So make sure you guys share. Make sure you guys like. The more you guys share, the more you guys like, the more questions that you guys get. So here we go. Let me turn this thing around. Money. There we go. Hey, give me thumbs up. Give me thumbs up. I want to make sure that we can see that. Can we see that? And also, your boy got a timer because, I get yelled at all the time. Oh, my God, you talk too much. And, oh, my God. Hey, if you don't like it, sorry, there's nothing I can do for you, right? So I got a timer. We're going to be good. We're going to be going through these things. But, hey, so you're going to see these nice little interruptions that are going to happen every 5 to 10 questions, okay? So here we are. We're doing NCLEX questions. Make sure you guys participate. Participation is the key. I'm kind of, sort of, but not really, but really kind of funny. It all just depends on my day right now. I'm kind of doped up on some meds on these pain meds, so I'm Gucci out here today. The more that you like, the more questions that you get. But whatever, you do you. Guess how many likes I want? All of them. Not some of them, not a few of them, but all of them. All right, give them to me. Give them all to me. We need 10,000 followers. I need 10,000 followers so I can stream from the PC because streaming from the phone is ghetto. You feel me? So I want to start streaming from the computer because that way you guys can see this thing as a whole instead of it just being, I don't know, from my phone to my computer. But, whatever. You do you. I'll always talk about the 7-day NCLEX course. If you want to know what that is an NCLEX course that I created that is currently in its pre-launch phase because I understand what it's like to fail my exam. I failed my exam 3 times, y'all. 3, and I passed on the 4th. And I never want anybody to feel like a failure. I never want anybody to feel as if they're not going to be able to get through this exam. Like I don't ever want anybody to feel like they're the only ones who are not going to be able to do this. Okay. My NCLEX had a lot of prioritization, which client would you see first type deal. Yep. Because Gut, that's considered what we call management of care. Management of care makes up anywhere between 17 to 23%, depending on what you're looking at. But it is the largest section on the entire exam for the RN and for the PN NCLEX exams. Okay. So, that's why I created it. Right now we're in the pre-launch phase. It's going for $48. Once you have it forever, and you get every update. Like as a matter of fact, I just updated the endocrinology section last night, and I think I updated another one from not respiratory but fluid and electrolyte imbalances. All right, so you guys get those content as well as we're working on NGN stuff, and that stuff's going to be going up relatively soon. Okay. Also, don't troll my chat. If you troll my chat, I'm going to troll you and you're going to get a 600. What's a 600? That's 600 seconds, which equals 10 minutes, which also equals a ban, which means we're going to ban you. But I'm not going to ban you for 10 minutes. We're going to ban you forever. So if you come in here running your mouth, talking about there's too much yapping or too much whatever, hey, this is how we interact with one another. That's the only way I can interact with, the tons of y'all. So if you don't like it, then you can leave. But hey, you troll me, you're getting a 600. And sometimes I leave it up to democracy. I'm just like, hey, what do y'all want? Anybody coming in this chat acting up? Just let me know 600 and I'm like, who? And then we'll see what's up. Also, I don't gatekeep. I got these questions off of nurselabs.com. So if you guys want to go see, guys, go check that out, nurselabs.com. So they do NANDAs, nursing diagnosis, all kinds of stuff. All right. So here we go. Participation is the key, baby. Let's jump into it. All right. So here's our first question. There are 4 clients with infections in the ED and only 1 private room is available. Which among the clients is the most appropriate to occupy the private room? Is it a client with a cough who has tuberculosis? Is it a client with toxic shock syndrome and a temperature of 102.4? Is it a client with diarrhea caused by C. diff? Or is it a client with a wound infected with vancomycin resistant VRE? We'll just say VRE. What are we thinking? Jilly said, what did you do differently to pass the 3rd time? Emma says A. Hey, you got a lot of question marks on there. Emma, are we sure or are we just guessing? Queen question Lexi. We got A's, we got C's. Jilly says A. Okay. Veronica says A. KD says C. Jilly, there was a lot of things that I had to do differently. Like I had to really sit down and figure out, what did I need to do for myself? I needed to put myself on a schedule, recreate the testing center, create a time management slip for myself, like what I did every hour on the hour type deal. All right. I'm gonna give you guys another 30 seconds to answer this question while I answer her. Also, I created a study schedule. Like I know pharmacology was the hardest section for me. So I studied pharmacology first and then I worked my way through that. Pharmacology and pediatrics were like the toughest for me. So it's the only one that is transmitted via droplets. But it says may, so I don't know. Okay, so there's those key words, right? So we got 4 clients, right? In the emergency department, only 1 private room, right? Which among the client is most appropriate to occupy a private room? So then you got to think of, okay, we got like A, tuberculosis. What type of precaution is that? Toxic shock. What precaution is this? What precaution is for C. diff and what precaution is for VRE? All right. Give you guys 5 seconds. 3, 2. All right. Let's see what the answer is. And the answer is A. The answer is A. So it is tuberculosis. Let's see. Private rooms should be occupied mainly for clients with infections that require airborne precautions such as tuberculosis. Despite the gains in tuberculosis control and the decline in both new cases and mortality, it still accounts for a huge burden of morbidity and mortality worldwide, right? So it's definitely the airborne precaution that we want to take care of. But then we also got to think of like C. diff is puts us on what type of precautions? What type of precautions does C. diff put us on? Shout out to everybody for the follows. Is it Quinn? Thank you for the follow. So what are we thinking? So we got A, right? So you got to also think to yourself, it's just like, which one is the most appropriate, right? Oops, I went too far. Which one is the most appropriate for the private room, right? All right, cool. I think we got, everybody seems kind of quiet in the chat right now, so I think I'll just go on to the next one. Let's see what's up. All right, so question number 2, the nurse is assigned to a client who has been diagnosed with disseminated herpes zoster. So paint a picture. Yes, you're right. Contact, right? Yep. Hand wash, water. That's right. So disseminated herpes zoster. So let's think about this. Now we're essentially talking about our PPE and our precautions, right? Which PPE will the nurse plan to use when preparing to assess the client? Select all that apply. So don't just give me one answer. Give me all of them. All the answers that require for herpes zoster, right? And then also, what's another one for herpes zoster? What's the other? What's the disease process that makes, so to speak? Quinn, it's Quinn says ACEF. Okay. All right. What else we got? What else are we thinking? Shout out to all y'all that are out here hanging out. We're doing NCLEX questions right now. Essentially, we're talking about precautions, standard precautions. So looking at everybody. Trying to see what the answer that they're coming up with. What are we thinking? What are we thinking? What are we thinking? I'm going to give you guys another 20 seconds. Oh, Quinn is the only one that gave me answers? Oh, man. What's up with that? Jilly says ACE. So ACE. Okay. Is it Mel says ACE? All right. I wouldn't really necessarily worry about disseminated, but think about the disease process. That's just what the disease process is. So think about this. What is herpes zoster? Like, what is that? Like, what does that create? We got AE. Okay. Aura says A. Lydia says AR. What's AR? You mean just A? Or A and E, I'm assuming, because the R is right next to the E. Oh, okay. I got you. Veronica says A. So remember, this is select all that apply. I don't know why it looked like that. There we go. I got it. What the heck? Bro. Hold on, I'm fixing it. I don't know what the deal is. See why I say it's ghetto? There we go. Much better. There we go. All right. What do we got? Shan, thank you for the follow. Jilly, thank you for the follow. All right, here we go. All right, cool. All right, let's see what the answers are. Hey, so herpes zoster, right? Let's see what the answer is. So here we go. So herpes zoster, shingles, right? Shingles, right? So the nurse should don an N95 mask or high efficiency particulate air filter respirator, a gown, and gloves because herpes zoster, which is shingles, is spread through airborne means and by direct contact with lesions. Okay? So got A, C, and D. So A, C, and D. So A was gloves, C was gowns, and D was the N95. Okay. So this is good, like when, especially for those that are like in pathophysiology, when they start talking about herpes, because there's different variants. You know, you got herpes zoster, herpes simplex 1 and 2, so on and so forth. You need to know what type of precautions that you have to have in regards to taking care of that patient. So like, okay, so they're both airborne and direct contact. So what's the other ones for, like, if you have somebody who has, like, you know, an HSV1, like, you know, direct contact, right? Or are they on standard precautions or anything like that? Same thing with TB. If they have active TB, what's the precautions for that? Or if they have latent TB, what are the precautions for that? Okay. All right. Check this out. We'll go on to the next one, see what y'all are doing. All right. Question number 3. A newly admitted client is suspected to having avian influenza, which is the bird flu, due to increased dyspnea and dehydration. So keywords in there, dyspnea and dehydration. Right. So this is where your medical terminology comes into play. What does dyspnea mean? Obviously, what does dehydration mean? Which of these prescribed actions will the nurse implement first? So on a scale from 1 to 10, or I'm sorry, on, you know, if we numerically name them 1 to 10 or whatever, what is the very first thing that we're going to do? So A, is it give Tamiflu? Are we going to instill 5% dextrose in water at 100 mLs per hour? Are we going to collect sputum samples? Or, blood and sputum specimens for testing? Or are we going to start O2 using a non-rebreather mask? We got D. I thought I saw somebody say something else. Nope. Okay, so we got D's. Okay, D's. D. All right, what else we got? Shout out to everybody that's hanging out. What else we got? So we got D. Okay. All right. So we got D. Linda says D. Okay, Linda. What else we got? I'm going to give you guys another 10 seconds. We're going to kind of fly through these questions today. Dun, 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 dun. All right, cool. Looks like we got a general consensus of what our answer is. So let's figure it out. Here we go. And of course, the answer is D. The nurse's first action should be to start oxygen therapy because the respiratory manifestations linked to avian influenza are most likely life-threatening. Patients with respiratory compromise should be placed on supplemental oxygen and monitored closely for signs of deterioration, as these patients are at high risk of requiring intubation and mechanical ventilation. So shout out to y'all. After you show the answer, Could you say the priority order you would prefer? What do you mean? What do you mean, Lexi? You got to give me a little bit more detail. All right, so there's that answer. So obviously we would want to give O2 because according to the question, the patient is already having increased dyspnea, right? So based off of what I would want to do first, based off of a systematic approach like 1, 2, 3, and 4, which one do I want to do first? And I want to give them the oxygen, okay? There's that. All right, cool. Let's go on to question number 4. The charge nurse is delegating tasks to her subordinates in the medical unit. Which infection control activity should she assign to the experienced nursing assistant? Okay, so is it A, asking clients about the use of immunosuppressant medications? Is it B, demonstrating correct hand washing for client visitors? D, disinfecting blood pressure cuffs after clients are discharged? Or is it D, screening clients for upper respiratory tract symptoms? Lovely says B. Linda says B. Quinn and is it Mai? And Mel say C. What's the question? It says like oxygenate them. Then you would do something about hydration, then test, and then treat. What? Lexi, I don't even know if I'm understanding what you're saying. Are you saying essentially like what I would do? So remember, when you're taking your exams and when you're taking NCLEX or anything, it's not necessarily about what you would do, right? It's about remember, it's all about perfect world. Linda says, never mind C. You sure about that? I just failed this exam, so I know it's C. Okay. All right. Lydia says C. Okay. I need to read this carefully. That's why. Hey, so remember RTFQ. If you're new here, RTFQ, for all my people that have been in here for a while, when I say RTFQ, tell me what that means. Tell me what RTFQ means. It definitely, you would definitely want to read the question carefully. You definitely want to do that. But Lexi's in here, and I know she's been in here long enough to hear me say what RTFQ means. So there you go, Linda. There you go. Look at that. Linda knows what's up. Linda knows what's up. Read the explicit word question, even though I say that word all the time. All right. So we got some C's. We got some C's. Well, who else says something? We got a B and a B. Quinn says, you know what? I know it's C because I failed this exam. So let's see what this answer is. All right, here we go. The answer is C. Disinfecting blood pressure cuffs after clients are discharged. Nursing assistants can support agency policy to disinfect items that come in contact with intact skin, such as blood pressure cuffs, by cleaning with chemicals like alcohol. Depending on the nurse's role, some tasks can be delegated to a CNA or a UAP, as it says on NCLEX, depending on their scope of practice. Essentially, the nurse can delegate tasks to a CNA anytime help is necessary. So as long as it's within their scope of practice, they can do it. Everybody can disinfect a blood pressure cuff, right? So the one way to remember delegation is like we don't delegate what we eat, right? As well as you got to realize that the nurse can do everything, but the UAP and the LPN can't do everything that the RN can do. Okay. So shout out to y'all. Appreciate all the likes. Appreciate all the follows. We're going to the next one. We're just going to fly. We're going to fly through these. We're going to fly through these today on this Friday. So here's question number 5. The nurse is caring for a client with a leg ulcer that is infected. Oh, sorry. Yeah. Let me say that again. The nurse is caring for a client with a leg ulcer that is infected with vancomycin resistant SRS, which is VRSA or VRSA. Which of the following nursing actions can a nurse assign to an LPN? So, hey, what can you do? Right? What can for all my LPNs and LVNs is like what can and what you can't do. So is it A, assess risk for further skin breakdown? B, collect wound cultures during dressing changes? C, create methods to improve the client's oral protein intake? Or is it D, educate the client about home care of the leg ulcer? We got B, we got B, we got B. What else we got? Shout out to all 14 of y'all hanging in here rocking with me on this Friday. Y'all could be anywhere else, but y'all here with me. I was about to say Martini. Marty says B. Liddy says Liddy. I'm already over here giving you a nickname. Lydia says B. All right. What else we got? What else we got, y'all? What else? Yeah, my bad, Marty. And now all I'm thinking about is Back to the Future now. Hey, McFly. Oh, man. I'm going to give y'all about another 10 seconds. see what y'all got. But I think for the most part, everybody already has this one answered. So the biggest part about when you're an RN taking this exam and you're delegating to LVNs or LPNs, you need to know what they can and can't do. LVNs, you need to know what you can and can't accept. You need to know what you can and can't do. And that's the biggest difference between LVNs and RNs. All right, here we go. And so, of course, the answer is B, collect wound cultures during dressing changes. So performing dressing changes and obtaining specimens from wound cultures are part of an LVN, LPN's education and scope of practice. And an LVN, LPN can perform routine procedures such as ostomy care, catheter insertion, wound care, blood glucose checks, and obtaining EKGs. So, of course, you need to know what you can and can't do, and that is what an LVN can do. So shout out to y'all. Appreciate all the love. Appreciate all the likes. If there shouldn't be any questions on this one. If there are, go ahead and ask them, and let's see what's popping. Let's keep going. Oh, look at that. We're on a break. Hey, shout out to y'all. Hey, so every 5 questions, we're going to do a little check-in. Make sure everybody's good to go. Make sure you guys smash that like button. Make sure you guys share. All right. Hey, participation is the key. I'm kind of sort of not really, but not really funny. I don't feel like I'm super funny today just for the fact that, your boy is kind of drugged up, as well as he has a knee that's swollen like 1,000 times the size of his other knee. But participation is key. We're doing NCLEX questions. I'm doing these for y'all because I love y'all. I appreciate y'all. The more that you like or the more gifts that you get, the more questions that you get. But, in the end, you do you, boo. I want all the likes, all of them, not some of them, not a few of them. I want all of them, just all of them. Hey, we're shooting for 10,000 followers. That way I can stream on the PC so everybody can see, essentially doing the PowerPoint on the computer instead of, doing it like this. It's being ghetto. Audrey says rice. What are we talking about? Rice. You making rice? You got rice cereal? Like, what are we talking about? 7-day NCLEX course. Of course, I always talk about that. That's the course that I created. Check it out. Links in the bio. $48. Once you get it, it's yours forever. You get all the updates that are coming in right now. It's in its pre-launch phase. So, hey, help your boy go from Spirit and Frontier all the way to Emirates, because that's what we about. First class, baby. Don't troll my chat. If you troll, you get a 600. A 600 means you're going to get banned. And if you get banned, then you get banned forever. 600 is just like my little thing that I got from another YouTuber that I follow for a long time. And that's what his like the little cue to ban people. Loved it. So I decided to adopt it for myself. Also, I don't gatekeep. If anybody wants to know where I got these questions from, I got them from nurselabs.com. They not only do they have questions over there, they also have nursing diagnosis, NANDAs, all those other good things that you guys need to know for when you first start nursing school. So I want to know who y'all are, where you're from, where you're at in your nursing journey. Are you a brand new nurse? Are you a prereq nurse? Did you start school this week? You start school next week? Did you graduate? Taking that NCLEX multiple times? Somebody already came in here and told me that they passed. Somebody already came in here and told me that they failed. But I'm telling you right now, it doesn't matter how many times you take that exam. No one's going to care. No job's going to care. I promise you. that. They're just going to be like, oh, you got that license? Cool. Get that ass to work. That's exactly what they're going to say. Mel, you take yours next week? Hey, you good. Ain't no need for crying. Hey, like I say, if you scared, go to church. That's what I'm saying. If you're scared, go to church. You know what I'm saying? So y'all are going to be all right. Trust and believe me. Y'all are going to be okay. If I can fail that exam 3 times and pass on the 4th and be a nurse for 3.5 years, then hey, y'all can do the same exact thing. I promise you. I'm doing awful on ATI, but amazing on Archer. Stick with Archer then. But then again, if you're on ATI, you may need that as an exit, like for whatever your exit exam is. I'm in LVN school entering my last term. Shout out to you, Linda, because you're going to get through it. Hey, before you know it, it's going to be over and done with. All right. Hey, but no further questions. I appreciate y'all. Let's go on to the next one. It's for incentive. It's for an incentive. What do you mean, Mel? It's for an incentive. Yeah, no problem, Linda. You good? I'm about to call you Lydia. Look, we got Lydia and Linda in here. I'm about to get y'all both mixed up. Archer's real. I like Archer. Archer's pretty good. ATI, I'm not a fan of. HESI, I'm not a fan of either. I had HESI when I was in school, and like I said, definitely was not a fan of HESI at all. So here we go. Question number 6. The charge nurse from the unit receives a call from the pediatrician wanting to admit an 8-year-old with rubella or measles. Which of the following is which of the following is of most concern in deciding whether to admit the child to the unit? Remember, of most. If I could do one thing and leave, what would it be? Right? That's what the most means. Like priority, right? The priority. The unit is not staffed with the usual number of RNs. B, there are several children receiving chemotherapy on the unit. C, no negative flow rooms are available on the unit, or is it D, the infection control nurse liaison is not on the unit today? So what are we thinking? What are we thinking? Manasa said, how all those who failed don't give up. I passed NCLEX. Yep. Manasa passed on her 7th try, y'all. Y'all can go on my YouTube and y'all can go into my TikTok and you guys can see that video where she did her testimony. From my school, if you get a 72, 92, the green light. Well, it all just depends. Yak says B. We got B, 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 B. Oops, I meant to say all. But okay. So, I mean, the money incentive, yeah. I personally, I mean, I don't know. Like I said, I'm not a fan of ATI, but there are people that swear by ATI. They love it. I've done, it's hard. ATI is impossible. Well, I wouldn't say it's impossible, but ATI and HESI are put in those positions to make it harder because it makes it harder than NCLEX. And that's what everybody will tell you, that it's harder than NCLEX. But it doesn't really help you at all if you don't have a standard. In my opinion, all nursing schools should start right off jump from NCLEX style questions. At least if it's not in the first semester, at least in the second semester, after fundamentals and health assessment, so on and so forth. And ATI is definitely hard, and so is HESI. And I hated HESI so much. I'm gonna give y'all 5 seconds, but everybody pretty much is saying B. So I'll give you guys some time. All right, time's up. Here we go. The answer is C. No negative airflow rooms are available on the unit. The child cannot be admitted to the pediatric unit without the implementation of airborne precautions, which is required for clients with rubella. One of the components of airborne infection isolation is respiratory protection for healthcare workers and visitors when they enter a airborne infection isolation room. Recommendations of the type of respiratory protection are dependent on the patient's airborne infection and the risk of infection to persons entering the room. So the answer is there's no negative flow. There's no negative flow because we got to think, if we have an airborne precaution room, we don't want a positive. We don't want it to push all the infection through the cracks of the doors out to the rest of the hospital. We want that air to be sucked in through the door and then it's evacuated through a HEPA filter that goes out the hospital, if that makes sense. So if you think about positive pressure takes whatever's nastiness that's inside the room and it pushes it out the room, versus how if you're in a negative pressure room, it sucks the air in from outside and it filters it through a filter like chimney that goes outside the hospital. Airborne, think MTV. Yeah. Music, television. That's right. No, but that's a really good way to think about it. What's MTV stand for? Tell them, Audrey, in case those individuals that are in here that don't know what MTV means, because you got people that are in different aspects of their or different places within their nursing journey. So what does MTV mean? All right, but I think everybody got the general consensus of understanding about, hey, this is an airborne type of precaution, right? So hey, we can't have them in here if we don't have a negative room. Okay, so. Go on to question number 7. Shout out to all 18 y'all hanging up in here. Hey, if you're new, we're going over NCLEX questions. Let me know who you are, where you're from, where you're at in your nursing journey. All right. So question number 7, a 7-year-old girl who has just endured allogenic stem cell transplantation will need protective environmental stimulation. Which nursing task should the nurse delegate to the nursing assistant? Select all that apply. The good old Satan questions. Measles, tuberculosis, varicella. Absolutely. So, select all that apply. Those good old Satan questions. So, by the way, just in case nobody's tracking, select all that apply questions are still on the NCLEX. Multiple choice questions are still on the NCLEX. They have not gone away. Okay. So, you still have to know how to answer these questions. So, our first one is educating the client to perform careful hand washing after using the bathroom, communicating with the family members about the grounds for isolation, stock the client's room with the required PPE, reminding the visitors to wear face masks, gloves, and gown, or posting the precautions for protective isolation on the door of the client's room. So we got CDE, CDE, CDE. Not to be confused with CTE. R.I.P. Aaron Hernandez. No, let me stop. All right. Victoria. All right. I see you. Quinn says C or A, C, D, E. Okay. Hey, so what can we not delegate as nurses? Lydia says C, D, E. What can we not delegate as nurses? Audrey says D, E or C, D, E. CNAs cannot educate. Okay. Because you can't delegate what you can't eat, right? All right, I'm gonna give you guys 10 more seconds. Oh, it says delegate. Yes. Hey, RTFQ, Quinn. RTFQ. Read the fucking question, Quinn. That's not directed towards you, but you know what I mean. That's just nothing but love, because I want you to read the question. Because if you don't read it, you would get this question wrong. If this was on the old NCLEX and it was select all to apply, if you pick one more that you shouldn't have picked, you get the whole thing wrong. All right, and that's what we don't want. We want you to read the question. I want you to read it. All right, here we go. Answer in 3, 2. So you are correct. It is CDE. I'm sorry that it's so small, but I blame somebody who did my questions for me. I'm just playing. So here we go. The answer was CDE. The nursing assistant is capable of stocking the room and posting the precautions on the client's door, because all staff who care for the client should be familiar with the various types of isolation. Reminding visitors about previously taught information is a task of the nursing assistant, although the RN is responsible for the initial teaching. Okay? So CNAs or UAPs, they can reinforce the initial teaching that the RN had already given them. Okay? Are we tracking on that? Quinn, does that make more sense? Let me know. Just give me thumbs up. Shout out to y'all. Make sure you guys share. Make sure you guys smash that like button. You let me know. Shout out to all 15 of y'all. We're about to go on to the next question. I just want to make sure we're tracking. All right, cool. I think we're good. Cannot assess or initially teach. Facts. You cannot do that. All right, here we go. So question number 8. In which order? All right. It says in which order will the nurse perform the following actions as she prepares to leave the room of a client with airborne precautions after performing oral suction? So we got remove gloves, remove N95, take off goggles, take off gown, and perform hand hygiene. So what order do we want that in? I'm gonna give you guys some time for this one. I'm gonna give you guys some time since we got to put it in order. What are we thinking? Hey, if you're just now joining, welcome. My name is Kevin. We're doing NCLEX questions for nursing students and nursing graduates. So make sure you guys smash that like button. I appreciate you guys being here. Right now, we're trying to put this one in order. So I want to know what order you guys would put this in. Quinn, you should be pretty close. If you're doing precautions and stuff, you should be knowing what to put on and what to take off. DAB, AE. Well, let's see, Cal. DAB, right? Cal says DAB, AE. What else we got? I know Cal ain't the only one that got the answer up in here. I know Cal ain't the only one who got the answers up here. What are we thinking, y'all? What are we thinking? Jimmy Allen. Mr. Delaware? All right, what are we thinking? Yeah, that's what I thought. See, I remember. Hey, look, you come here enough. I know who you are. Who is that? Audrey says ADCBE. Okay. Linda says ACBDE. Okay. Hey, so I just want to let y'all know you'll get questions like this on NCLEX. But on NCLEX, you kind of click and drag or kind of click and drop them into the order that they need to be in. Okay. I'm going to give you guys about 10 more seconds. Well, 15 more seconds. Let's see how we're doing. All right. Man, 15 seconds go by fast. As soon as I say it, it's gone. Hey, anybody ever had a Zions? Hey, don't judge me because it's grape, okay? Anyways, so here we go. And 3, 2. The answer is A, D, C, B, and E. So that is the order that we have it. This order will prevent contact of the contaminated gloves and gown with areas like the hair that cannot be readily cleaned after client contact and stop transmission of microorganisms to the nurse and the client. The correct order for donning and removing of PPE has been standardized by the agencies of the CDC and OSHA. Okay, Was it how you feeling? These ones are always confusing. Yeah, they are always confusing. The thing about it is, how does it go? I'll jump back on there. How you feeling? My knee hurts, man, and I'm drugged up right now. But I'm on here doing my thing, and I'm out here for y'all. This is what we about. So, but as of right now, I'm doing pretty good. So shout out to y'all. So let's see. It was AD. So remove gloves. So essentially, when you remove gloves and you take your gown off. So gloves come first, the gowns go next. And then C, it's because you'll take off this essentially will come off at the same time. But gloves, gown, and then you take off your goggles. And then you take off your N95 and then you wash your hands. So washing your hands is last. So this is one of those ones. It's just like, think about it when you're in clinicals or you're at work or anything like that, how you're supposed to put them on. Okay. All right. Question number 9. The nurse assessed the client and noted shortness of breath and a recent trip to China. All right, so this is no pun intended. I'm gonna keep going. The client is strongly suspected of having severe acute respiratory syndrome or SARS. Which of these prescribed actions will the nurse take first? So what is the very first thing that I should do? Place the client on airborne and standard precautions. Do I want to introduce normal saline at 75 mLs an hour? Give Solumedrol 1 gram IV, or take blood, urine, or sputum culture? So what do I want to do? Right? They're already coming in having shortness of breath coming from China. What do you mean jail? I don't know what that means. I'm going to jail? I ain't trying to go to jail. What's wrong with you? Tracy says A. Okay. Linda says A. Lydia says A. Mel says A. Okay. Jimmy says A. Okay. All right. So remember, it's like, what is the very first thing that we should do, right? And everybody says A. I think we all have a general consensus of what what our answer is going to be. And so let's see what the answer is. And of course, the answer is A. SARS is considered deadly. So the initial action is to protect to protect other clients and healthcare workers by securing the client in isolation. If an airborne agent isolation negative room is not yet available, droplet precautions should be initiated until the client can be moved to a negative pressure room. So I'll give you an example. Like when the Rona was going rampant, when I was working in the ICU, we didn't have negative pressure rooms. Like some rooms could be converted into negative pressure rooms. And I think that's what like a big push is to be happening now in the future. But I'm telling you right now, like we had to go in there, I mean, every single time, you name it, new gown, new glove, new gown, new glove, new mask, not even new mask because we were running out of freaking N95. So we had to use the whole N95s the whole shift. So I'm just saying, it's like if you don't have a negative pressure room, there's droplet precautions, but then you're always going to be on droplet precautions and airborne precautions anyway. Okay. So shout out to y'all. Shout out to all 15 of y'all in here rocking with me on this Friday. I appreciate y'all. Let's go on to the next question. All right, question number 10. The nurse is caring for 4 clients receiving IV infusion of normal saline. Okay. Which client is at the highest risk for bloodstream infection? Okay. Let's think about this. What is the highest? That's another word for that. What is the most, right? A client who has a non-tunneled central line of the left internal jugular vein. A client with a implanted port in the right subclavian vein, a client with a PICC line in the right upper arm, or a client who has a midline IV catheter of the left antecubital fossa. It says A. Are we all saying A at the same time? Are we all saying A, or are we A in for a different one? What are we doing? We got A's. Are we all saying A? What's our answers? What are we doing? I say A. Okay. Tracy says A. Lydia also says A. Jimmy looked like he said A as well. Audrey. I keep wanting to call you Aubrey, and I don't know why. I'm sorry. If I call you Aubrey, at least you know I'm talking to you. All right, we got A. Okay. You got to also know about, hey, like, as an RN, like, what are our responsibilities when it comes to these types of lines? Like, we're talking about our central lines, our pick lines, who can do what, who can clean them, what they look like, where they're supposed to be. Right. So, and then LVNs, like, what can you do? If you're an LVN or LPN student, what can you do in regards to pick lines? Like, can you draw blood from them? Can you do anything with them? Can you clean them? Can you change the dressings? Can you do anything like that? That's the stuff that is the most important. All right. So it looks like everybody, or at least a few of y'all, are saying A. So let us see what the answer is. And of course, the answer is A. Central lines are associated with a high infection risk. The skin of the neck and chest has a high number of microorganisms, and the line is non-tunneled. Such factors increase the risk of infection. About half of nosocomial bloodstream infections occur in intensive care units, and the majority of them are associated with IV devices. So central venous catheter-related bloodstream infections are an important cause of healthcare associated infections. And as somebody who worked in the ICU, and I also did a little bit of work with infection control or quality control, this is something that they check every single day. Hey, how long has their central line been in? Have the dressings been changed? What do the dressings look like? So on and so forth. Same thing with Foley catheters. How long have they been in? Do they need to come out? What is the order for them? What does the patient look like? So on and so forth. All right. So you guys got to know. You guys got to know the rules and the responsibilities of when it comes to what we call CVAD, so the central venous access devices. Speaking of that, I'm actually working on a lecture for CVADs that's going to be going up on the into the course here shortly. So shout out to y'all. Shout out to everybody that answered. Appreciate all the love. Thanks for all the likes and the shares. Make sure you guys share. Hey, so we're taking another break. Hey, we're flying through these right now. We're flying through them. Hey, we're doing NCLEX questions. And like I said, I never gatekeep. I tell you where I got the questions from. I got them from nurselabs.com. So if anybody is in there, just now starting school and they want to see where I got these questions from, they can go over there and check them out. You get the questions, you get the answers and the rationale. So make sure you guys go over there if you were looking for something free, because it is free $99. Like I said, we're doing NCLEX questions. Participate. I love the participation. The more that you guys participate and give me some love, the more I give you guys back. I'm kind of, sort of, not really, but really kind of funny. But not today. I'm kind of just meh. But I appreciate y'all rocking with me. The more that you guys like, the more questions that you guys get. But whatever, you do you in the end. If you don't want to like it, and that's fine, and that's cool. Then, but I still love you though. But guess how many likes I want? All of them. So I got like 6.4 thousand likes. You can go ahead and give me some more. Hey, we need 10,000 followers. So make sure you guys share it to somebody, because the more people that follow, the more, the higher chance that I get to where I can start to stream this off my computer instead of it being ghetto and me streaming like this. And then somebody telling me, oh my God, Kevin, it's all kind of fuzzy and it's not working. Right. So I just don't like getting yelled at by Monica, and she stay yelling at me. So I'm trying to get my life right. OK, trying to get my life right. So, yeah. So there's that. Hey, so like once again, 7-day NCLEX course. Link is in my bio. If you're taking your NCLEX in the next 6 months to a year, or if you just now started school and you're looking to get a jump on your NCLEX right now for $48, you get it. You get the review. You get everything. And the review is about to be dropping here shortly. Got a whole bunch of stuff that's coming up. So, hey, for $48, you get it. You get it forever. It's not a subscription base, at least not yet. But you get all the updates, and including the questions and then the breakdown. You get videos that are going to be like this, but they're going to be way more in depth. All right. So, yeah, make sure you guys go over there and check that out. That link is in my bio. Also follow me on YouTube, Instagram, and all those other social media platforms, because I'm super active on TikTok and on Instagram, because that's where y'all are at. So, I love and I appreciate y'all. Don't troll my chat. You troll my chat, you get a 600. A 600 just means you're going to get banned. It's just a fancy way of me telling y'all that. And if y'all see somebody coming into this chat acting a fool, you guys have some democracy up in here to be like, hey, I vote to give somebody a 600. I'm like, all right, cool. And then the moderators are going to go and do their thing. So let people know before they come up in here. They act a fool, they getting banned. All right. And like I said, I don't gatekeep. nurselabs.com. Make sure you guys go check that out. All right, cool. And with that being said, I want to know who you are, where you're from, if you're brand new here, where you're at in your nursing journey. Are you just now taking the NCLEX? Have you taken it multiple times? Are you just now about to start school? Sorry if you guys hear my son back there. He's screaming because he's pretty much crazy. I don't know where he gets it from. But and then also, like, are you a prereq student? Like, let us know down in the comments. Let's stir up a really good conversation, and let's see what you're about and whatever question you guys got. All right, here we go. On to the next one. So, question number 11, the school nurse is asked which action will have the most impact on the incidence of infectious diseases in schools. The correct response is granting written information about infectious control to all parents, ensure the students are immunized according to national guidelines. Is it C, make soap and water easily accessible in the classroom, or is it D, educate students on how to cover their mouths when coughing? So what do we think? Lydia said, I'm going to begin my nursing journey. I have medical billing and coding experience in C. Okay, shout out to you. Hey, I'm telling you right now, as an RN with medical billing and coding, you talk about like as an RN with medical billing and coding and working for an insurance company, you can make some really good ass money. I ain't even lying to you. That billing and coding, yep, I'm just letting you know. That's a phenomenal, that's phenomenal experience to have. All right, so what are we thinking? I need some answers. I got 15 people up in here and ain't nobody answer me yet. Come on. I need some answers. Give them to me. Give them to me. Jimmy says B. Okay. Audrey. I'm about to say it again. Audrey says C. Linda says C. Is it my or May? If it's my, give me a number 1. If it's May, give me number 2. Says C. Tracy says B. Okay. Oh, so it's my. Got it. Cool. I'm in my last semester for ADN. Shout out to you, Audrey. Shout out to you. Hey, before you know it, you're going to be like, boom, graduated, and you're going to be like, boom, sitting for your exam. All right. I'm going to give you guys about 10 more seconds. See what we're doing. 10 seconds go by really fast. So here we go. And here's our answer. And the answer is B. You want to ensure the students are immunized according to national guidelines. The incidence of once common infectious diseases like measles, chickenpox, and mumps has been mostly effectively reduced by immunizations of all school-aged children. Infectious diseases that used to be common in children in the United States, including polio, diphtheria, pertussis, rubella, and chickenpox, are preventable with vaccines approved by the Food and Drug Administration. All right. Sorry if y'all hear him screaming. I don't know what his deal is. He's just being a turd McGraw. I don't know what his deal is. All right. So the biggest thing is making sure that your kids are immunized. And here's another thing, too, is like if your kid's not immunized, they're not going to let them go to school. Right. If they're not immunized, they're not going to let them go to school. OK, so. All right. So it looks like we're doing pretty well on that. So we will go on to the next question. All right. Number 12. Question number 12. The nurse is caring for a client with VRE. Which action can be delegated to the nursing assistant? Is it A, implement contact precautions when caring for the client? Is it B, monitor the results of ordered lab cultures and sensitivity tests? Is it C, teach the client and family members about means to prevent transmission of VRE? Or is it D, interact with other departments when the client is transported for ordered tests? What are we thinking? Jimmy says A. Okay. All right, we got A. All right, what else are we thinking? Linda says A. Okay. Audrey says A. It's so hard for me to say Audrey. I don't know why. Tracy says A. Okay. All right. What do we got? Who else didn't answer? Lydia, what you got? What you got for me? Lydia? I know you're down there smashing that like button, but what you got? I need an answer. You got me A? All right, cool. All right. Let's see what the answer is. And the answer is A. We want to implement contact precautions when caring for the client. Correct implementation of contact precautions should be well known by the hospital staff. Depending on daily needs, this can involve changing soiled sheets, cleaning up spills, changing bedpans, setting up equipment, and reducing the spread of germs and infection in the patient's living area. So yeah, you want to always maintain those standard precautions. Those contact precautions. You want to know what precaution that you are, which one fits under which specific category, right? So we know that tuberculosis fits under, airborne, right? And we also know that, like C. diff fits under contact, so you got to know which ones they fall under. Okay. Let's see what else we got. see what else we got. All right, cool. All right, we look like we're doing good. On to the next one. Here we go. Number 13, a client who has frequent watery stool is admitted to the unit due to dehydration, possibly caused by C. diff. Which nursing action should the charge nurse delegate to the LPN? So, hey, what can you do? What can the LPN do? What can the LPN do? Thanks, Aubrey. Aubrey. See, I did it. Thank you, Audrey, for the crown. I appreciate it. Is it A, give the ordered flagyl 500 milligrams PO to the client? Is it B, reconsider the client's medical history for any risks for diarrhea? Is it D, doing ongoing assessment to determine the client's hydration status? Or is it D, explaining the purpose of ordered stool cultures to the client's family? We got C. Okay. We got C. Jimmy says C. Okay. What else we got? Audrey. Audrey says C. All right, cool. Shout out to all 10 of y'all rocking with me. Shout out to all 10 of y'all. Yeah, hey, y'all could have been anywhere else, but y'all here with me. Shout out to Diddy, because that's what he said. You know what I'm saying? So here we go. Let's see what the answer is in 3, 2, and the answer is A. The answer is A. The LPN's scope of practice and education includes the administration of medication. Each state board of nursing regulates what the LPN can and cannot do. In general, LPNs provide patient care in a variety of settings within a variety of clinical specializations. LPNs can usually administer oral and IV medications. I don't like this question. However, I don't like that last part where it talks about IV medications, but to each their own, because it definitely said IV medications. Aren't they able to assess after the initial by RN? Correct. After an initial assessment. So I'll give you an example, Mel. So let's just say we had a patient that came in from the operating room, right? And I'm the RN and I assess them and they're all good to go. But then you have them as the LPN and you assess them and they're okay. And then you turn around an hour later and then you assess them again and then now they're not okay. So you can assess them, but then your assessment requires more direct assessment by the RN if your patient goes from stable to unstable. But LPNs do not do the initial assessment. But the initial assessment is only done by the RN. And remember, this is something about the LPN, not the RN. Remember, you got an RTFQ. You got to read the question, Audrey. Don't second guess yourself. Usually your first answer is the correct answer. 9 times out of 10. 9 times out of 10. Okay. And that was a very good question, Mel. Oh, I hope I answered it for you. I hope I answered it correctly for you. All right, here we go. Question number 14. A 25-year-old client comes to the outpatient unit with complaints of diarrhea, abdominal pain, shortness of breath, and epistaxis. Which action should the nurse take first? So what is the very first thing? What is the very first thing that I'm going to do? I will admit that the wording is confusing. I can tell you right now that on NCLEX, the wording is not this confusing. Honestly, it's very straightforward. But these questions are meant to be thought-provoking. That's why they give you so much information. So what's the very first thing that I want to do? Is it learn whether the client has had recommended immunizations, ask the client about any recent travel to Asia or the Middle East, C, have the client pinch the anterior nares firmly for 5 minutes, or D, request an ambulance to take the client quickly to the hospital. So what is the very first thing that I want to do? Tracy says B. We got B. Jimmy says B. Audrey says B. Okay. All right. So it says, which action should I take first? Right. It's giving me, hey, it's telling me all these complaints about diarrhea, abdominal shortness of breath, of epistaxis. Right. But you got to know, if you notice, there's nothing in here there's nothing on the question that says anything about, hey, I give oxygen or anything like that. OK. So, of course, if that was an answer, that's where we would go, because you have a patient who is talking about shortness of breath, but it's not giving us that, right? But you're saying B? All right, let's see what B is. Tracy says, come on, B. Come on, like you're rolling some dice. Got him. All right, let's see. And the answer is B. Ask the client about any recent travel to Asia or the Middle East. Based on the client's manifestation, avian flu or the bird flu is suspected. Outbreaks of bird flu have occurred in Asia or the Middle East. Airborne and contact precautions should be, hold on one second. Yeah, airborne or I'm sorry, airborne hand contact precautions should be instituted immediately. Although adapted to birds and often causing only mild illness, avian influenza viruses can be extremely dangerous with successful transmission to humans, with a high percentage of confirmed cases requiring hospitalization and frequent ICU care. So sounds a little bit familiar, like, like the Rona, where we got it from a bat. So they say, right? So, hey, y'all be safe out there, because, them numbers is going up. Hey, with them numbers, I mean, patients. And of course, with them patients going up, anybody that's trying to be a travel nurse, the numbers is going up too. But you got to also think about, hey, if you're working in the hospital, you got nurses that are going to be ready to bounce and go get them some of them COVID contract monies. So be aware of that too. All right, here we go. Question number 15. A mother of a 14-year-old client receiving chemotherapy for leukemia calls out to the unit concerning her other child having chickenpox. Which of these actions will the nurse anticipate taking next? Is it A, plan to admit the client to a private room in the hospital? B, teach the mother about contact and airborne precautions? Is it C, educate the mother about the correct use of acyclovir? Or is it D, administer varicella zoster immune globulin to the client? Tracy says thumbs up. Tracy says A. Lydia says A. Linda says A. Okay. Audrey says A. Shout out to y'all. Hey, if you guys are new here, welcome. My name is Kevin. We're doing NCLEX questions right now. So I want to know who you are, where you're from. Make sure you guys smash that like button. Make sure you guys share. You never know who's going to need this in some way, shape, or form later on down the line. And if you know anybody that misses this, hey, they can check it over out on YouTube. I post all my TikToks over the YouTube, okay? So we got A's across the board. Come on, A. So let's see what A is. Let's see if it's A. And the answer is D. The answer is D. Administer varicella zoster immune globulin to the client. The development of varicella in high-risk clients can be prevented via administration of varicella zoster immune globulin prescribed by the physician. Varicella zoster immunoglobulin is a scarce blood product that is offered to individuals at high risk of severe chickenpox following an exposure. Hey, the more that you know, the more you know. This is why I love doing practice questions, is because you're not expected to know everything. Right? And you got to think, and here's another thing I want to bring up, is that not all these questions are going to be what you think they are. They're not all going to be right. They're not all going to be correct. You're going to disagree with a lot of them, right? But the thing about it is, like, if I gave you 100 questions, probably less than 10 of them would be like, wow, like, that's crazy. Like, that's incorrect. I don't believe it, yada, yada, yada. But it's not an excuse for you not to do well on an exam if you've been practicing, if that makes sense. Okay? So think about that. Okay? I guess it took time, not immediate. Yep. So shout out to y'all. Now let's go on to the next question. Oh, we're at another break. I appreciate y'all. Hey, if you're new here, I appreciate y'all being here. I appreciate the 10 people that are rocking with me. We're doing NCLEX questions. Hey, make sure you guys participate. The more that you participate, hey, the more love that you guys get. I'm gonna love y'all anyway, so it don't even matter. I appreciate y'all rocking with me with my knee swollen like 4 times the size of like a cantaloupe or whatever. If y'all really want to see it, y'all could just start sharing and give me like 1 million likes, and then I guess you guys see this large ass knee that I got going on here. The more that you like, the more questions that you get. Hey, regardless, I'm going to give you guys all the questions tonight anyway, so it don't even matter. But I still want y'all to smash that like button, and I still want y'all to share, because that's what we about around here. I want all of them. I want all the likes. Hey, remember, I need 10,000 people. I need 10,000 people to follow me, right? And I think we're sitting at right at almost 6,000 people, close to it. So the more people we get to follow, the more we can stream, and the more I can unghetto myself from this. 7-day NCLEX course, link is in the bio, $48. Make sure you guys go check it out. Once you have it, it's yours forever. Don't troll my chat. If you troll my chat, you get a 600. I know some of y'all are probably waiting for me to 600 somebody, but ain't nobody been jumping in. Like I said, today's Friday. So, yeah. Make sure you guys participate, all right? And then also, I don't gatekeep. If you guys want to know where these questions are, you guys can check them out on nurselabs.com. They got a whole bunch of questions over there. All right. And so, hey, there's another thing I don't want you guys to forget. OK, I don't want you guys to ever forget that they have multiple choice questions. They have select all that apply. They have the click and drag. They have, the point and stuff. They have the fill in the blank. They have the doses calculations. They have all those. OK, those questions have not changed. The format for NCLEX has not necessarily changed. It's been upgraded a little bit, especially when they throw the case studies in there. And that's really it. Like, you'll get 3 case studies. 3 case studies will consist of 6 questions out of that one case study. So that's 18 questions if I did my math right. Yeah, 18 questions. Okay, so you really shouldn't have a huge issue there. Like, I can give you everything that you need under the sun, and then the next 6 questions are going to come from all the information that was given to you in that case study. But your multiple choice is still going to be there. Your select all the apply is still going to be there. So I don't want everybody to think that, I just got to focus on these. I was like, no, you gotta get yourself a good amount of everything. Okay. Do you have your call bell? Don't get out of bed without help. Do you need anything before I leave? Sorry, I thought I was in clinicals. There it is. Are you talking about me? No, I'm good to go. We good out here. We good. I don't need no call bell. I got crutches, baby. All right, here we go. Hey, question number 16. 2 student nurses are assigned to a client with lung cancer who is receiving oxycodone, 10 milligrams orally for pain. During the assessment, which findings should the student nurse report immediately? Meaning, hey, something is wrong. I need to report this to the nurse that I'm working with, or my preceptor, right? Is it A, decreased pain levels from 6 to 2? Is it a heart rate from 90 to 100? Is it request by the client that the room door be closed? Or is it a respiratory rate of 8 to 10 breaths per minute? Oh, no, Jimmy, we good. We good out here. I promise. We good. Jimmy says D. Okay. Jilly says D. Okay. Jilly says D. So you guys got to think about, what is oxycodone, right? What is it going to do? It's for pain, right? But what is it going to do on a pharmacokinetic, level? Like, what is it going to do to us? User 50 says B, CNS depressant, right? So what is that going to do to everything else? Right? So is it going to make my pain go down? It's going to make what? What's it going to do? So that's how you have to think. Like, you always hear me say, like, let me paint a picture for you, right? So it's like, what do you think? I'll give you guys another 10 seconds. Slow it down. Respiratory depression, right? Okay. So these are the things that you have to think about, okay? So I'll give you guys about another 5 seconds. A bunch of y'all said D. Some people said B. One person said B. Okay, cool. So here we go. In 3, 2, and the answer is D. Respiratory rate of 8 to 10 breaths per minute. A drop in respiratory rate indicates respiratory depression, which also puts the client at risk for respiratory acidosis. Signs and symptoms of an oxycodone overdose include bradycardia, hypotension, meiosis, respiratory depression, somnolence, muscle flaccidity, cold and clammy skin, and death. So that's just like any type of narcotic or opiate. Like, one of the signs and symptoms one of the reactions to it is a decreased respiratory rate, right? And those are the things that we always have to look out for. All right. Shout out to y'all. Good job. Shout out to all 10 of y'all rocking with me. If y'all are new here, welcome. We're doing NCLEX questions. So we're going on to the next one. The nurse just received the client's morning lab results. Which of these results is most concerning? Is it a sodium of 134, potassium of 5.2, magnesium of 0.8, or is it a calcium of 10.6? What are we thinking? What are we thinking? Let's see. Got B. Julie says B. Lydia says B. Audrey says B. Tracy says D. Okay. So at this point, a lot of people ask, like, hey, for NCLEX, do I need to memorize lab values? And the answer is yes. You need to know what your lab values are. Not only do you need to know what the normal lab values are, but you need to know what type of issue will happen if your lab values are outside of range. Like, what am I looking for? Right. So if I have a respiratory rate, or not say respiratory rate, if I have a potassium of 6, what am I looking for? You don't know lab values? Tracy, lab values are the ones, I don't really tell people that you have to memorize a lot, but lab values are the ones that you need to memorize, because you need to know, not only you need to know what the normal ranges are, but you need to know what is happening to your patient, if they are above the normal or if they are below the normal ranges. Right. Correct, Jimmy. Correct. And here's the good thing about NCLEX is that NCLEX won't come to you with numbers that are super close like that. And so, like, if you know, call 911. Calcium, that's how I remember that. Oh, okay. I was just like, what? You gonna call 911? Ma'am, you're at the hospital already. Call 911. All right, cool. All right, cool. Jimmy got it. You got it. All right, so let's see what the answer is. So the answer is C. It's magnesium of 0.8 milliequivalents per liter. With a mag level this low, the client is at risk for EKG changes and life-threatening ventricular arrhythmias. A normal serum sodium level is between 1.46 and 2.68 milligrams per deciliter. Now, here's the thing. You will see these numbers that are very skewed. Like different types of books will say something different. Okay. But they're all relatively close. But when on NCLEX, these numbers will be really low. So obviously a 0.8 is way lower than a 1.46, right? So it's completely obvious. You know what I mean? So think about that. Hypomagnesemia can be attributed to a chronic disease, alcohol use disorder, gastrointestinal losses, renal losses, and other conditions. Signs and symptoms of hypomagnesemia include anything from mild tremors and generalized weakness to cardiac ischemia and death. So this is why it's important that you know what your lab values are. Because if I say, hey, you have a low mag, now what could you be thinking about? Oh, they could be having signs and symptoms of tremors, weakness, and then heart issues. You know what I mean? So just a little nugget for y'all. Just a little nugget. All right, on to the next one. Question number 18. The assigned LPN of the unit reports to you that a client's blood pressure and heart rate have decreased. And when her face is assessed, one side twitches. What is the most appropriate thing to do as the nurse? So you as the LPN have done your assessment, and you're like, oh, okay, this isn't looking good. Hey, RN, help! I need you, right? And so now as the nurse, what do you do? What do you do? Right? The LPN's done their part. Now, what do you do? Now, is it assess the client's is it the pupillary reaction to light? Obtain a neurological exam request for the client, review the client's morning calcium levels, or retake the client's blood pressure and heart rate? We say D, okay? D. All right, so we got D. Okay, what else? What do we think, Lydia? What do we think? I'm gonna start shotgunning y'all now. What do y'all think, Lydia, Jilly X? What are we thinking? What are we thinking? I'm going to give you guys another 15 seconds. Audrey says C. Review the client's morning calcium. Okay. Jilly says C. Okay. And here's another thing too, guys, guys and gals. When you guys read the rationales, make sure you guys read the answer. Why is that answer correct? But then also read the answers to why they are incorrect. Okay. Because that is how you learn. That is how you learn, and you're able to retain that information. And so, of course, the answer is C. Review the client's morning calcium levels. Facial twitching on one side of the mouth, nose, and cheek is a response to tapping the cheek just below or in front of the ear is a positive Chvostek sign. It is a neurological manifestation of hypocalcemia or a low calcium, right? So this is the answer, right? Read it. Now, if you got the answer wrong, read it. And now you want to go to the ones where you're just like, okay, why is this answer incorrect? Does that make sense? Honey, I appreciate you for sharing. Thank you. All right. So that when you guys are studying, that's how you guys should study. Answer the question. Hey, if you get it wrong, it's okay. That's why we practice out here. All right. If you get it wrong, that's okay. Read the answer, see why it's correct, and then go down here and see why these answers are incorrect. You'd be so surprised about 5 to 10 questions down the line how another question could be asked. And you're going to be like, oh, wait, I just reviewed that. You know what I mean? All right, cool. So question number 19, a client going through intense chemotherapy treatment is admitted to the unit. Which of these would the nurse instruct the nursing assistant to report to prevent an acid-base imbalance? All right. Is it A, hair loss during the morning bath? Is it complaints of pain associated with exertion? Is it failure to eat all the food on the breakfast tray? Or is it prolonged episodes of vomiting, nausea, and vomiting? What are we thinking? What are we thinking? What are we thinking? I got 9 of y'all in here still rocking with me. I need 9 answers. Jilly says D. Jimmy says D. Lydia's over there smashing that like button and gave me the answer D. Audrey says D. Linda says D. All right, cool. All right. Oh, got me a heart. Hey, Audrey, you're sweet. I appreciate you. Shout out to you. Number 8 member on the team. Okay, I want to talk about. All right. So it looks like everybody, general consensus saying D. Make sure you guys share. Hey, if you guys are new here, we're doing nursing questions, for nursing students and nursing graduates taking their NCLEX, or even if you're just in school. So about to answer this question, about to see what's up. And here we go. And the answer is D, prolonged episodes of nausea and vomiting. Repeated nausea and vomiting can lead to an acid-base deficit and metabolic alkalosis, right? So here's one thing to remember about metabolic and respiratory. So like if the pH and the bicarb are both in the same direction, then it's metabolic, right? But if it's not lung, or if it's not vomiting or suctioning, your default answer is always going to be metabolic acidosis. Always remember that, okay? And like you never get a metabolic acidosis type of question wrong if you remember those steps, okay? Other causes of metabolic alkalosis could be a loss of hydrochloric acid from the stomach through vomiting, potassium depletion due to the use of diuretics for hypertension, and excessive use of laxatives. Hey, there's a big issue that's going around where people are like buying all up the turbo lax or whatever the fuck you want to call it. And I saw it on nurse.org where people are just buying up all the laxatives. I'm just like, but why though? Y'all better stop listening. Y'all better stop watching TikTok. TikTok's gonna have your fucking buttholes hurting. I'm just keeping it a stack. I'm just being honest. All right. Hey, so shout out to all 12 of y'all. We're going to question number 20. A newly hired nurse is assigned by the charge nurse to care for a client with acute renal failure and hypernatremia, right? So paint the picture, right? Anything hypernatremia is above what? 145, right? Which action can the nurse assign to the nursing assistant? So what can I assign as the RN to the CNA or the UAP? Is it administer 0.5 or 0.45% saline by IV? Is it assess daily weights for trends, check for indication of dehydration, or is it render oral care every 3 to 4 hours? Jimmy says B, redemption, and then he says B. Tracy says B. It's only lay. Is that what you say? Only lay? Only Lee says D. Jilly says B. Tina Bobina says D. Audrey says B. Honey says B, or says D. I'm sorry. Oh, somebody got censored. I don't know what y'all said. I heard acting up. All right. So we got some C's. We got some. Oh, lay. I got you. Yes, lay. Slay. Lydia says D. Okay. Got you. I'm tracking. All right. So we got D, and some people said B. Some people said we got D and B up in here. Okay. Hey. All right, Jilly. Hey, so remember, usually your first answer is the correct answer, right? Remember, RTFQ. I'm going to give you all 5 more seconds to answer. RTFQ. Shout out to all the love. Shout out to all the likes. Here we go. In 3, 2, and the answer is D. Render oral care every 3 to 4 hours. The nursing assistant can provide oral care to a client. This is within the scope of practice of a nursing assistant. The scope of practice for a CNA includes tasks such as daily or basic daily patient care. This includes activities such as bathing, eating, and dressing, but also smaller things such as grooming. All right. So, yep. It says those CNAs can take weight, but I think it's D. Okay, look, ma'am, you got the answer correct. I almost spilled this all over my computer and I almost got scared. Lord of mercy. All right. Hey, remember, always read these questions. Always read your rationales. This is where you get the bulk of your information when you're studying, right? So when you're studying, you're doing Q&A, always do it this way, right? And here's another thing. When you guys are studying your questions, don't do it in study mode. They need to be in exam mode. So you need to practice like you play. So if you're going to go take your NCLEX, or if you're going to take an ATI or a HESI or whatever, when you take those tests, they don't give you the answers right after, right? Do your 85 questions or however many you're going to do, and then you read and you review it afterwards. That is the way to do it. Practice like you play. The key word that made me change was assess. There you go. Because who can assess? Jilly? right? All right. Hey, so shout out to all y'all. We're doing NCLEX questions. Make sure you guys participate. I'm kind of not really, but really not funny today. I'm really not all that funny, y'all. Like, I ain't gonna lie to y'all. Like, I'm all like drugged up. My knee kind of hurt, but I'm still out here for y'all because I love y'all and I appreciate y'all. I appreciate y'all being here. I do these questions for y'all. Yeah, so make sure you guys participate. Hey, more love. Hey, more likes, more gifts, more whatever. You guys get more questions. But regardless, y'all, we're going to get all the questions anyway because that's what I'm about. Make sure y'all get them. But hey, in the end, y'all do you. I want all the likes. I want all of them. Not some of them. Not a few of them. Not a little bit of them. All of them. All of them. Get them to me. I need 10,000 followers, y'all, so I can stream off the PC so I can be unghetto. You know, because ain't nobody trying to stream off of this thing all the time. I'm just letting y'all know. It's a 7-day NCLEX course. What is that? That's my NCLEX course that I created. That link is in the bio for $48. Once you get it forever. You get all the updates that are coming in there right now, and it's in its pre-launch phase. So a lot of people are asking, like, hey, is the review in there? The review is in production right now as we speak, and that is the most important thing that is going up, and that is going up soon. So make sure you guys check that out. Hey, so if you're taking NCLEX in 6 months or a year from now, or if you just started school, look, let me tell you, it's a huge flex to be like, look, I got an NCLEX review for $48 and everybody else is spending crazy amounts of money on some other stuff. Just saying, check it out. Or if you don't like it or if you don't need it, you never know. Share it to somebody else. They might need it. Don't troll my chat. Luckily, I haven't had nobody come up here and troll my chat. So if you troll, you get a 600. A 600 just means you're going to get banned. And if anybody comes in here and if I don't see it and they act up, just let me know. 600. I'm going to be like, who? It's a democracy, baby. Straight up Spartacus style. Yes, yay or nay. So we'll do that. Also, I don't gatekeep. If you want to know where I got these questions from, I got them from nurselabs.com. They got all kinds of stuff over there from nursing diagnosis to, you know, everything that you would need depending on where you are in your nursing school journey. All right. Or even if you're not a nursing student and you're a prereq nursing student or you're a pre-nursing student, hey, it's a good spot for you to get started. All right. So I want to know if you're new, who you are, where you're from, where you're at in your nursing journey. Hey, let us start a good conversation down here in the bottom, and we'll see what's up. All right, let's go through these next questions. All right, here we go. The nurse is caring for a client diagnosed with diabetic ketoacidosis. Which action should you delegate to the nursing assistant? Select all that apply. Right, so it's not just one answer, or it could just be one answer, but you know. Is it A, assess for indicators of fluid imbalance? Is it B, review finger stick glucose results every hour? Is it C, measure vital signs every 15 minutes, or is it D, document intake and output every hour? Miss Lay says it's C and D. It says me when I'm a nurse. That's what I'm talking. Hey, Jilly, I want you to speak things into existence. You say that you will be a nurse. Say it all the time. C and D. Tina says C and D. Okay, I'll give you guys about another 10 seconds. It says C and D. All right. Jilly says C and D. Okay. CD. I see what you did there. CD. They don't even make those no more, I don't think. CD, but maybe also B. Okay. All right, Audrey. All right. I'm gonna give y'all 5 more seconds, see what everybody's thinking. 2, 1. And the answer is C and D. So CD, a well-trained and educated nursing assistant, is knowledgeable in measuring vital signs and recording intake and output. In addition to helping patients with daily tasks, CNAs spend time taking vital signs and recording information about a patient's condition. As a result, a CNA serves as an invaluable link between a patient and the rest of the healthcare team. I'm telling you right now, I love CNAs. I worked in the ICU for over a year, and I had, I think, one tech or CNA that worked with me, and then she was a godsend. Let me tell you, a godsend. Maybe A2. I could argue B also. B got me, but it just said review. Exactly. All right. So question number 22. Here we go. A client is admitted to the unit with a diagnosis of deficit fluid volume related to excessive fluid loss. So that is a nursing diagnosis. For those that don't know, that is what a nursing diagnosis looks like. Which action related to fluid management should be charged to a nursing assistant? Is it A, administer IV fluids as prescribed by the physician? B, develop a plan for added fluid intake over 24 hours? Is it C, provide straws and offer fluids in between meals? Or is it D, educate family members to assist the client with fluid intake? Everybody says C. I see C coming across the board, right? And so here's the thing. is even though this question and the answers may sound really silly, right? Always read the question all the way through and always read the answers all the way through, because there could be a word that's in there that'll change the entire question, which will then change the answer that you pick. Okay. So I'll give you guys about another 10 seconds, even though I probably don't think y'all need it because everybody already shouted out the answer. And so the answer is C, provide straws and offer fluids in between meals. Additional fluid intake can be reinforced by the nursing assistants once it is part of the care plan. The CNA's main role is to provide care or provide patients with basic care and assist them in their everyday activities, particularly when patients have a hard time doing a few activities on their own, such as bathing, right? And yes, Audrey, that is very, very true. You want to, that's why I say it's so important that you RTFQ, 100% RTFQ every single time. Okay. So, shout out to y'all. Shout out to all 12 of y'all that are in here. Appreciate y'all smashing that like button. Make sure you guys share. Hey, so question number 23. A group of nursing students, remember, paint the picture. And remember, this is mostly y'all. A group of nursing students is assigned to care for a client with a nasogastric tube connected to wall suction. One student asks why the client's respiratory rate has decreased, right? Choose the best response. So what is the best response that I could give? What is the one thing that I could say as an RN to the nursing student? Right? So A, whenever a client develops an respiratory acid-based problem, decreasing the respiratory rate helps fix the problem. Is it B, the client is hypoventilating because of anxiety, and we will have to stay observant for the development of respiratory acidosis? Is it C, it's common for a client with uncomfortable equipment such as a nasal gastric tube to have a lower rate of breathing? Or is it D, the client may have metabolic alkalosis due to the nasogastric suctioning, and the decrease of respiratory rate is a compensatory mechanism? Jimmy says it's D. I know that was a mouthful, y'all. It says D. Gotta run. Have a good night. Thank you, Lydia, for stopping by. Appreciate having you here. Make sure you follow. Make sure you share. We got D. Got D. Okay. We got D. We got D. It has to be D. Okay. Well, let's see what the answer is. If it has to be D, let's see what it is. The answer, of course, is D. Nasogastric suction. Hey, didn't I just say that earlier? I was just like, if it's not lung or if it's vomiting or suctioning, your default answer should be metabolic acidosis. So this is nasogastric, right? So this is vomiting / suctioning. Nasogastric suctioning can result in a decrease in acid components and a metabolic alkalosis. The client's decrease in rate and depth of ventilation is an attempt to compensate by retaining carbon dioxide. Vomiting or nasogastric suctioning generates metabolic alkalosis by the loss of gastric secretions, which are rich in hydrochloric acid. Whenever a hydrogen ion is excreted, a bicarbonate ion is gained in the extracellular space. Okay. So those are those little tidbits to remember, especially in regards to, when you're remembering like how the gastric suctioning and all those things happen. Okay. How often do you do your live? So I do my lives Monday, Wednesdays, and Fridays at 5:30 Central Standard Time, aka Texas time, because that's the only time that matters. I'm just playing. But no, seriously, I do it at Central Standard Time, 5:30, Monday, Wednesday, Friday. I didn't do it this past Wednesday because I had surgery on Tuesday. So, couldn't be here. I would have been all in a fog and it wouldn't have been all that great. So, question number 24. A 56-year-old male is newly admitted to the medical unit. Which factor alerts the nurse that this client is at risk for an acid-base imbalance? Is it A, a client takes antacids for occasional indigestion? Is it B, client gets shortness of breath with extreme exertion? Is it C, the client has a history of myocardial infarction 1 year ago? Or is it D, the client has chronic renal insufficiency? Lay says it's A. Okay. I'll give you guys another 20 seconds and we'll see. Lay says it's A. Remember, acid-base imbalance. So remember, acid-base imbalance is lung, vomiting, suctioning type deal. Okay. 10 more seconds. Honey says B. Okay. All right. Well, let's see what the answer is. And the answer is, Tina says D. The answer is D, chronic renal insufficiency. Chronic renal disease and pulmonary disease are risk factors for acid-base imbalance in the older adult. Renal failure patients have an altered acid-base balance. Most commonly, a mixed type of metabolic acidosis is observed because metabolically it happens with your kidneys first. Jimmy says D. We already got the answer. We got the answer, Jimmy. We got the answer. We got the answer. All right. On to the next one. Question number 25. The monitor watcher from the telemetry unit informs the assigned nurse that the patient has developed prominent U waves. Which laboratory value should the nurse monitor? Is it A, sodium, B, potassium, C, calcium, or D, magnesium? Nah, Jimmy. Nah, Jimmy. You ain't do all that. No, I'm just playing. What are we thinking? I'll give you guys another 20, 30 seconds. We got B, D. I got receipts. No, you good. You know who else got receipts? Deion Sanders. That's what I'm saying. I already know it. They coming. Tomorrow, they coming. Hats and shades and all. Joanna says B. Okay. All right, I'm going to give you guys another 15 seconds. See what we're doing. All right, there we go. I'm so late, but I made it. Joanna, we at the end. And the answer was B. Joanna got the answer right. The nurse should immediately check the patient's calcium levels for hypokalemia. Common EKG changes with hypokalemia include ST depression, inverted T waves, and prominent U waves. Heart blocks may also transpire to clients with hypokalemia. Yeah, shout out to you for getting it right. Knew it, should have trusted myself. Ma'am, always trust with your first instinct. Go with your gut instinct, okay? Always go with that first. And ladies and gentlemen, we only did 25 today. I wanted to get some in today rather than not get any in at all. So, hey, we did that. I appreciate you guys participating. I told you I'm kind of funny. Today I'm not all that funny, but I appreciate y'all rocking with me anyway, all 12 of y'all. I appreciate all the likes and all the gifts. It really does mean the world to me that you guys come through while we're doing these things. So I really do appreciate it. Of course, all about the 7-day NCLEX course. That link is in my bio. Make sure you guys check that out. I didn't have to ban nobody today, which was great. And then also, you guys, I don't freaking, what is it? I don't gatekeep, right? So make sure you guys go over to nurselabs.com. And you guys go over there and check that out. If you guys don't know what I look like, hey, how are y'all? So I know I got my Jason Derulo look going on right now. I guess that's what people say. But yeah, I got a bunch of stuff that's coming up. One thing that I'm about to do that I kind of wanted to tell everybody is that I'm actually going to be doing a live webinar about the new NCLEX or the new generation NCLEX that got updated. I'm going to be doing that with TrueLearn and Picmonic. And I'm actually about to get off because I have that's about to come up. But then once that comes up, y'all are going to see it. And everybody that needs it, I would highly recommend that you guys jump into it because it's essentially going to be just like this, but we're going to be, with a different software as well as, talking about all the updates that happened in April that some people don't know that are, essentially afraid of the exam. And then to give you guys a little bit more, ease of your mind. When you guys are going to take this exam, okay? Don't be afraid of it. Like I said, I failed my exam 3 times, passed on the 4th. I don't ever want anybody to feel like a failure, which is another reason why I created that NCLEX course. So how's your foot doing? So it was my knee, and it's still swollen like 2 times the size of what it normally is supposed to be. But, it's out here. I got it propped up down here, right here. So, but I appreciate you asking. I appreciate all the love and everybody asking how I'm doing. But, your boy is doing good. No complaints. I tore my meniscus actually, and had to have a meniscus repair because I fell at work. So that's what happened. Partial credit for select all that apply. That is correct. It is partial credit for select all that apply. But then there's also a thing that people think that, all the old question types are gone, and that's not true. So, multiple choice, select all that apply, the case studies are now new, the dosage calculations, all those things are still there. Those aren't going anywhere. I'm sorry to hear that. Hope it still. Yep, it's better now. It's better now that I've had the surgery. I've been waiting for a while to get that. So bow tie. Yep, bow ties are in there as well. So of course, with my NCLEX review that I have coming up right now, that's going to be with all new stuff. And so once I recording those videos and everything, getting them edited, those are going up on the course as well. So make sure you guys be on the lookout for that. But I hate to cut this short. I'm usually on here for about 2.5, 3 hours. But today your boy has got to cut it short because he has to go take care of some other stuff, essentially for y'all. So last little plug. I appreciate everybody being here. My name's Kevin. Make sure you guys check me out. All the social media platforms. Check that out. Link is in my link tree in my bio. Check out YouTube. Check out Instagram. Check out all that good stuff. Remember, get off your beach. Whatever you think that you're going through, get off your beach. Don't stay there. You got to push through. So who was it? Jilly? I know Jilly said that she was going through it. Jilly, I don't want you to feel like you're never gonna progress. You need to get off your beach. You need to push through that storm. You need to figure out what you aren't doing correctly, and you need to push through it, and you need to fix it. And I promise you, you'll be able to accomplish the goal that myself and tons of other people who were unsuccessful at that exam you'll be able to do. All right. So with that being said, I appreciate everybody. Thank you guys for stopping by the live, and I will catch everybody on Monday. Bye.